Hello,
Yeah, good
doctor.
morning. Good morning, Robert. How are you feeling today?
Well, doctor, I'm fed up with this urine infection, and
Mm-hmm.
yes, I just don't know what to do. It keeps coming back,
Oh,
and yeah, well, I'm desperate. I don't know what to do. Uh,
yeah.
yes, what do you think, doctor?
Yeah. Could you please let me know when it firstly it started and about the recurrence and what the last time when it was happened and what are you giving? Are you still in medication for your urine infection or not?
Doctor, you asked too many questions. So which one should I answer first?
Yeah. When it started and
Okay.
about yeah.
It started, it's been 3 months now, and
Mhm.
I get a urine infection, and then it is treated, and then when I finish the antibiotics, it starts again after a few days. So I think it is the fifth or sixth time I have this urine infection, and yeah, I'm just fed up with it, really.
I can understand you about that. So when was the last time that you had this problem?
It was 10 days ago, and then, yes, and then after I finished the antibiotics, I had, I think, 3 days of antibiotics, and then it started again 3 days ago.
Mm, okay. Beside urine infection, do you have any other symptoms like fever or anything else?
No, no, no.
Okay. Okay. And what about your diet system? Uh,
My
uh,
diet is good, yes, doctor. I eat a lot of fruits and vegetables. I don't smoke, I don't drink.
mm,
I take 2 glasses of water every day. I have a couple of
oh,
coffees. I
um,
walk half an hour every day.
except,
Yeah, I'm
mm,
I'm very healthy and active and
oh,
independent. Yeah, and I live on my own.
oh, well done. That's a well done. It's a good healthy lifestyle. It's
Thank you.
really good. Yeah, and you well done. So beside that. Uh, I encourage you about the hygiene. You know about the hygiene. Hygiene is very important.
Oh yes,
Uh,
I definitely do that. I'm very careful with the hygiene. I'm a tidy person, doctor. But yeah, what can I do?
yeah, just when you're emptying the bladder and yeah, hygiene is very important to respect on that time and washing hands and maybe sometimes glass if you need, and also it's important to wait for a moment and trying to empty again because of UTI. You have this problem, and you have experience in the past also about you may know about the also. So the hygiene is very important to be considered for
Yeah,
your.
doctor, I told you I'm a very tidy person. I have no problem with my hygiene. You know,
Uh,
um,
Good.
you don't mean that I'm not clean. But I'm very tidy.
Yeah, that's good. That's good. I remind you about that. So now can we go to treatment option now? Is that okay with you?
Yes. Okay.
Yeah. For I want to prescribe some antibiotics.
Mm.
Have you heard about trimethoprim? Have you got this?
I
Uh,
think I've had it before. Yes. Yeah.
yeah, I
But
will
it doesn't work, does it, doctor? I've used it before, but it keeps coming back.
Yeah, at this time I will prescribe trimethoprim 300 milligram per day. It's for 3 days, and beside that I will prescribe nitrofuran. It's for 3 months, I think hopefully this medication will help you to to avoid the recurrence of the UTI if you follow the medication properly and take the medication on time and yeah. So is that okay with you?
Okay, yes, right.
Yeah, and any question? Do you have
No,
any question?
no.
Okay, okay. Uh, thank you,
Thank
Robert.
you. Okay, see you later.
See you later.
Bye. Right. Okay. How does that feel?
Uh, yeah, maybe no, it was good. Good,
Yeah.
not bad. Mm.
Okay. What score out of
Uh,
10?
I did one mistake because I did a very complicated questions about the onset, about the recurrence, and about the. Uh, uh, I did three questions in the same time. It was very confusing to the
Yeah.
patient.
Okay.
Yeah, yeah.
So, yeah, but that was multiple questions or combined questions. Uh, okay.
But in the next time, I was trying to do question simple. I
Yeah.
asked about diet. Then I had planned to ask about fluid and exercise, but you explain all of them together.
Okay. What score would you give yourself?
6.
Okay. What went well? So we want to know if you had good structure
Mhm.
and good rapport, connecting with the patient, information gathering,
I
and
think this time I asked my information gathering was a bit better than previous.
yes,
Mm.
in and information giving. Okay, so what could be done differently?
Only I did the complicated questions. That was
Okay,
not good.
so avoiding combined questions. What else?
Uh, so the main concern of the patient was recurrence of the UTI,
Mhm.
and I gave you trimethoprim and nitrofurantoin. So you said that I have took this medication before. Then how can I reassure you that this medication will help you in this time? And
Mhm. So you use some medical jargon that the name of the drugs. Okay, you can argue that this is not medical jargon; it's the name. But yeah, I mean, it doesn't make much the difference to me if you say it's 300 milligrams, 200, 150, or
so just
100.
I should mention I will prescribe you some antibiotic. Is that okay now?
Yep. And then you said about hygiene. How many times did you say hygiene?
Oh yeah, I didn't mention.
You said three times. You said hygiene. So you said hygiene is very important, and this is not nice to tell someone that you need to be careful with your hygiene. It means that you need to make sure you wash your hands or you clean yourself, that sort of thing. These are the things that even if you want to say, you need to mention very briefly and pass and say, well, of course, you know that hygiene is very important, and so Um, but when you say it 3 times, the patient gets upset and they say, "Well, I told you,
Mm,
doctor, I'm a very clean and tidy person. I'm not dirty.
mm,
I'm not okay." So if you emphasize, it will be offensive.
mm.
Uh, okay. So you're telling me that I'm not clean. Um, okay. Uh, so um, you asked me, is that okay if I talk about treatment options? Okay.
Mm.
You don't need to ask this question. Yes. Okay. Well, so what we can do, or our treatment options are these.
Or instead of that, can we move to treatment option now? Is that
Yeah. Yeah, you don't need that. You don't need to ask
ah,
questions. You just say, okay, okay, and now what the options we have are treatment options. And our treatment options are
mm,
okay, and we say our because that makes it more patient-centered. Okay, so our treatment options are right. That double voiding is a treatment option. Okay,
mm,
so double voiding. Double voiding means emptying the bladder. Double voiding is simply after passing urine, you wait a minute or wait a few seconds, and when you feel that you have finished, but
mm.
then just try to pass urine again.
Yeah,
Uh,
yeah, yeah.
okay. We use this usually for patients with
UTI.
no, patients with BPH and those who have residue. We have they have postvoidal residue. So
Uh,
because of the enlarging prostate,
yes.
the neck of the bladder goes up a little bit, and there is
Mm,
there's some space which keeps some urine itself. So
mm,
basically, they might have even up to 100, milliliters of urine. And
mhm,
that is the main reason for urinary infection in male patients, which is BPH in an 88-year-old man.
mm,
So it's because of the flow obstruction, outflow obstruction. Right. So basically, that's what you can explain. You can say any problem with the flow,
mhm,
with the flow of water or urine. So basically, you can ask them if they have dribbling, if they have urgency, if they have urinary frequency. You can ask about the symptoms in the information gathering. Okay.
oh, yeah.
Um, about the drugs and the other treatment option, which is drug therapy. Well,
Mm,
you mentioned okay. One option is to treat when UTI happens. That's what we
mm,
have been doing up till now. And your test result or your culture result shows trimethoprim is a good choice. Okay.
mm,
So because the patient asks you, okay, I think I've had it before, but it didn't work. Well, it works, but because of some problem, it recurs. It comes back again. So uh, another option
mhm,
uh, is to give you a low dose antibiotic uh, every night
mm,
for a prolonged period of time. Okay.
mhm.
So basically, we can give you a lower dose antibiotic to take every night, well, something
But we
for
can,
3 months, and then stop it. Okay, so that's another option. Would you like to try that?
mm,
Okay, And so basically, we have a plan now. Our plan is, yes, I give you 3 days of antibiotics to treat this one. Then I will give you a low dose nitrofurantoin, a low dose antibiotic to take every night, and you do the double voiding, and be careful, more careful with the hygiene, and then let's see what we can do. So that's the plan. Okay.
Mhm.
Right. Yeah, I think you did well, except that, yeah, that make sure you don't actually emphasize on uh,
Yeah, hygiene.
hygiene, and we don't need the name of the drugs that much. Some patients are alert and they know, but some of them just don't. And yeah, some basically questions in what are how your flow is. Basically, that would be a good thing to ask. And in explaining your management, double voiding, treating UTI, and prophylactic antibiotic.
Mm.
Uh, Good. Okay.
Yeah.
Uh, right. So we had two difficult cases today.
Yeah.
Uh, yeah, difficult cases or difficult consultations are the ones we had one that the patient wanted something specific,
Mhm.
and the other one didn't want the suggested treatment plan. Okay, so these are difficult consultations basically. The first one wanted to remove all the moles. The second one didn't want to have to reduce exercise or to have physiotherapy. And these are the ones samples of difficult consultations. And so in both, you used ethical principles and an ethical framework to respond, to say that, well, I'm here to give you the best advice, make sure you're not at harm. And
Mm.
the evidence shows this. Okay. So, how we deal with difficult consultations with ethical principles. Okay. Did we have breaking bad news, or
Mm.
did we practice breaking bad news, giving bad news to patients?
Maybe I'm sorry to let you know. Sorry to let you know.
Mm.
And unfortunately, can you use unfortunately?
No, not really.